Dr. Julia Ambler, a pediatric palliative care specialist, working for an organisation called the Big Shoes Foundation. Palliative care for children is really a holistic approach to their whole illness, to themselves, their symptoms, the disease and the family. And it really is a basic human right that everyone should have access to good pain control, to understand what they're going through, to be involved in decision making when it comes to their own health and illness, and where they spend their time getting their treatment. So the palliative care approach allows for that. In the traditional model of medicine, everything happens quite separately. Different specialists come in and they leave the child's life, dietitians, OTs, physios. Where palliative care is quite different is it tries to bring all of those people together. I think the main aim is really to manage the child as an entire human being in their whole context, so that their family is managed as well as their illness and them. It really focuses on quality of life and ensuring that whatever time left a child has on this earth, whether it be 20 years, whether they live to an adult or whether they die within the next few days, that whatever time space they have is really good quality of life. And for me that means it's largely about the child's personal growth, their development, their education, as well as having their symptoms controlled. So where palliative care is different is it tries to draw in all aspects of a child's care and really focuses on the quality of that child's life. A recent child we saw was a 3-year-old with an abdominal cancer which had spread and recurred, and there really was not more that the pediatric surgeons or the oncology team could do for the child. So where we made a difference in that child's life is simply the pediatric surgery department discharged that child home with no plan, with no backup, with no way of the family knowing what they should do next. And inevitably the child ended up back at a peripheral hospital, very symptomatic, lots of pain that was uncontrolled. And when we were called in, what we were able to do is firstly get control of the child's pain, and then when the child was feeling better, we could actually start discussing with the family about what they wanted for their child. They were aware that the child was going to die at some stage, but really for us it's about that, where they want to have that care in those last days, what the quality of life is in those last days. So what we were able to do for that family is once they understood what needed to happen, they then could be involved and participate in the decision making. And it was their decision, instead of being in hospital, which is really clinical and cold and not a place of love and warmth, is to get that child home. They were empowered to give the correct pain medication. They knew who to phone in emergency. They had a full plan of what they were going to do in each eventuality. So for where palliative care for that family made a difference was they firstly got to understand what was going on, then they got to be involved in the decision making, and at the end of the day they had a child who was really comfortable and who died at their own home, which was their choice.